and thank you for joining us for another session of the Cancer Care series. I'm Anisha Nayar, your host for the day, and I bring to you this special series on cancer, discussing various aspects of the disease. The COVID situation across the country and the world has been an additional challenge for cancer patients. The lockdowns suddenly stopped their treatment, while the ongoing medicines made them more susceptible to the COVID-19 infection. Cancer has also emerged as a comorbidity due to this reason. It makes caring for a cancer patient challenging as well. Now that we are gearing up for the festive season and a pickup in economic activity, it is more important than ever that cancer patients are aware of the risk and the precautions they need to take. This program is supported by Shilpa Medicare under its Public Awareness Initiative. To discuss how cancer patients and their families can cope with this double challenge, today we have with us Dr. Sushant Mittal, a senior consultant and medical oncologist at Sri Balaji Action Hospital Delhi. Welcome to the show, Dr. Mittal.
Thank you. Thank you, ma'am.
Thank you so much for being with us. This period after COVID has been very tough for patients who are suffering from chronic conditions, and cancer, of course, is one of them. Now, initially, there was a disruption in the treatment because, of the lockdown movement was stopped, and slowly we've opened up since then. Now, what are the precautions that cancer patients need to take? Because they need the treatment, but they need to keep COVID-19 at bay.
So this question has been asked to me many a times, and since the lockdown had begun, many of my patients were worried, and also my colleagues' patients were also worried as to how to go about it. तो हमने उन सबको यही समझाया कि जो पेशेंट्स ट्रीटमेंट कंप्लीट कर चुके हैं और फॉलोअप पे हैं वो अपने घर पे ही रहें, हमसे फ़ोन पे डिस्कस कर लें या व्हाट्सएप पे डिस्कस कर लें या टेली कंसल्टेशन कर लें, and they can send us the reports, and if everything is fine, they need not come for the regular follow-up visits. Second is patients who are already on treatment and are taking chemotherapies or hormonal therapies or immunotherapies. For them, we have tried to shift to them on oral chemotherapies so that they need not come to the hospital again and again. जहाँ तक मुमकिन है हमने कोशिश करी है, लेकिन सारे पेशेंट्स को हम ओरल टैबलेट्स पे कन्वर्ट नहीं कर सकते, so they need to come to the hospital. During this unlocked period, now patients have started coming back, and few of the patients unfortunately have progressed also because they were not able to take the treatment, or they were not able to travel, or not able to come to the hospital because of the pandemic. So जो प्रोग्रेस हो गए हैं उनकी थेरेपी हमने चेंज करी है, जो स्टेबल हैं दे आर डूइंग फाइन, तो हमने उनकी थेरेपी कंटिन्यू करी। थर्ड कैटेगरी ऑफ पेशेंट्स हैं जिनको अभी न्यूली डायग्नोज्ड हैं, जो इनका वर्कअप करना है, जो सस्पिशियस है कि इनको कैंसर हो सकता है, वी नीड टू इवैल्यूएट देम. फॉर देम वी गेट द टेस्ट डन एंड वी काउंसिल देम फॉर the treatment in which they need not come regularly to the hospital. We have few regimens in which patient needs to come weekly basis. So we have tried and shifted them on 3 weekly basis, or we have tried and shifted them to oral therapy. Patients have turned into COVID positive also. Cancer patients have turned COVID positive also, and because of that their treatment has been delayed. For that purpose, we have made them wait till the COVID situation gets better for them, and then we have restarted the therapy for them.
Right. डॉक्टर मित्तल, आप कह रहे थे कि जिनका फॉलो अप है, आप ज़्यादातर कोशिश यही कर रहे हैं कि घर से टेली कंसल्टेशन करके हो जाए, पर अगर फॉलो अप के दौरान हमें कोई स्कैनिंग करानी है, MRI कराना है, पेट स्कैन कराना है, या शायद बायोप्सी का सैंपल लेना है जो नए पेशेंट है, तो उनके लिए क्या प्रोटोकॉल है? क्योंकि जितना मुझे समझ है कि अगर आप हॉस्पिटल जाएं, भर्ती हों या कोई प्रोसीजर करवाएं, तो आपको कोविड टेस्ट हर बार लेना पड़ता है.
Yes, that's true. So that's what I'm telling, that a patient is a localite, they can come to Delhi or a resident of Delhi nearby place, then they can come to the hospital, we get the test done, every hospital or a diagnostic lab has their own protocols of how to go about the COVID. In my hospital, since it's a big hospital, we have a lot of patients, a lot of crowd is there. So we try and get the COVID test done where any of the bigger tests such as PET scan or MRI or CT scan. But for ultrasound and chest X-rays, we don't need a COVID because unfortunately, if the patient comes out to be positive and he has already been inside that machine, that then the whole machine gets sealed, then it has to be sanitized, and then rest of the patients suffer. तो जो दूर रहते हैं जैसे हरियाणा में रहते हैं, यूपी में रहते हैं, तो हम उनसे रिक्वेस्ट करते हैं कि आप वहीं पे लोकल अपने एरिया में करा के हमें रिपोर्ट्स भेज दें, हम उसी पे देख के उनको एडवाइस कर देते हैं।
ठीक है. Want to understand from you, Dr. Mittal, that what are the measures that caregivers of cancer patients should follow? Because like you said, not everybody can come to the hospital all the time. So there are people who are taking care of them, and we want to ensure that they are not at further risk of COVID-19 as well. So what are the must do's for caregivers?
Must rule is that they should follow the सैनिटाइजेशन गाइडलाइन, फेस मास्क पहनिए, हैंड रब यूज़ कीजिए, साबुन से हाथ धोइए फ्रीक्वेंटली। और अगर किसी को हो गया, मान ले पेशेंट को कोविड हो गया है और वो होम क्वारंटाइन में क्वालिफाई होते हैं, तो घर पे ही रखिए उन्हें और उनको अलग कमरे में रखिए ताकि बाकी जने जो बच्चे हैं, बूढ़े हैं, वो उन पेशेंट से दूर रहें और जब वो ठीक हो जाएं तब वो अपने कमरों से बाहर निकलें। इनफैक्ट मैं भी 2 बार क्वारंटाइन होना पड़ा मुझे, तो मैं भी एक कमरे में बंद रहा। मुझे भी वो खाना बाहर दरवाजे पे देते थे, मैं अपने कपड़े खुद ही धो रहा था, बर्तन धो रहा था, वो धो के बाहर रख रहा था। उसी हिसाब से उनको भी वो फॉलो करना पड़ता है। अगर पेशेंट की सैचुरेशन ड्रॉप होने लग जाए, ऑक्सीजन की रिक्वायरमेंट बढ़ जाए, देन डेफिनेटली दे नीड टू कम टू द हॉस्पिटल एंड गेट एडमिटेड। कैंसर के पेशेंट में थोड़ा दिक्कत ज़्यादा इसलिए होती है क्योंकि उनकी इम्यूनिटी कम होती है, तो वायरस स्प्रेड होना, उस वायरस के लिए स्प्रेड होना ज़्यादा आसान हो जाता है, तो इसलिए उनको ज़्यादा केयरफुल रहना पड़ता है।
नहीं, ज़्यादा केयरफुल रहना पड़ता है। फिर अगर मैं केयर गिवर हूँ तो क्या क्या मतलब मैं अपनी तरफ से सैनिटरी मेजर्स ले रही हूँ, पर ताकि हमारे पेशेंट ठीक रहे, would you suggest that you keep a SO2 monitor and monitor the oxygen?
Yes, पल्स ऑक्सीमीटर वो अपने पास रखें ताकि वो ऑक्सीजन सैचुरेशन चेक करते रहें। एक थर्मामीटर रखें, डिजिटल थर्मामीटर रखें, जो कि आप पढ़ के अपने डॉक्टर को बता सकें कितना है। और ऑक्सीजन हर कोई तो नहीं कर पाता, उनके लिए मैनेज करना मुश्किल हो जाता है, लेकिन अगर आप समझदार हैं, समझ सकते हैं कि कैसे ऑक्सीजन को लगाना है, तो डेफिनेटली ऑक्सीजन को भी लगाया जा सकता है। लेकिन उस स्टेट में मैं एडवाइस करूंगा कि घर पे ऑक्सीजन ना लगा के हॉस्पिटल में जाएं, क्योंकि आपको 2 बीमारियां एक साथ हैं, कैंसर और कोविड, तो उसके लिए मल्टी स्पेशलिटी ट्रीटमेंट चाहिए होगा। कुछ चीज़ें जो कोविड के डॉक्टर्स है वो हमसे फ़ोन पे डिस्कस करके कहते हैं कि डॉक्टर साहब आपके पेशेंट है, इनके लिए आपकी तरफ से क्या एड ऑन करना है, तो वो चीज़ें फिर घर पे मैनेज नहीं हो पाती। तो इफ अगर ऑक्सीजन की रिक्वायरमेंट है तो डेफिनेटली देन दे शुड गेट एडमिटेड इन द हॉस्पिटल। लेकिन अगर कोई नॉर्मल पेशेंट है जिनको और कोई कोमॉर्बिडिटी नहीं है, कैंसर वगैरह नहीं है और उनको ऑक्सीजन की जरूरत है, देन दे कैन बी मैनेज्ड एट होम।
तो ये क्या थ्रेशोल्ड रहेगा ये डिसाइड करने के लिए कि अभी ये कैंसर पेशेंट है, अगर उनको हो गया है कोविड तो उनको अब हॉस्पिटल मूव करना चाहिए, क्या थ्रेशोल्ड है?
अगर उनको हाई ग्रेड फीवर है, स्वेटिंग हो रही है जिसकी वजह से डिहाइड्रेशन हो रहा है, सांस फूल रही है, एक बार में पूरा सेंटेंस कंप्लीट नहीं कर पा रहे हैं, बेड से उठ के बाथरूम तक भी जा रहे हैं तो सांस फूल रहा है, ऑक्सीजन सैचुरेशन 96 या 95 के नीचे जा रहा है, देन दे शुड गेट एडमिटेड इन हॉस्पिटल। ऑल्सो अगर आपने रिसेंटली कीमो ली है और आपके ब्लड काउंट्स ड्रॉप कर गए हैं, उसकी वजह से आपको सुपरा एडेड बैक्टीरियल इन्फेक्शन होने का खतरा है, then you should definitely get admitted.
ठीक है. Doctor, you mentioned in your previous comments that some patients have progressed. What I understood is that their disease has progressed because of the disruption of their treatment.
Yes.
Now, we want to understand that for someone who was at stage 1 of cancer versus someone who is now at stage 4 of cancer, are they equally susceptible to getting COVID, or are those at an advanced stage more susceptible or at higher risk?
Definitely patients who are at advanced stage or stage 4 have multi-organ involvement because of the cancer, and because of that, those organs are at a lesser threshold to take COVID, and because of that, they are at higher risk for any mortality or morbidity. So, stage 1 at are lesser risk compared to stage 4. Higher the stage, more is the risk for you.
Right. Now, say we have a cancer patient who is in the early stages of the disease, and they are managing at home. Should they be proactively getting themselves tested for COVID frequently at regular intervals? Would that be a suggestion from the medical community
You mean for the patients or for the caregivers?
for the patients?
Not necessarily. If they are on the treatment, every hospital has their own guidelines. Like what we are following, if the patient is on active treatment, then every 14 days for any admission, they need to get the test done. But if the patient is coming for every 6 months or 1 month treatment, and that treatment is just continued at home, then they need not get it done unless and until they have symptoms or signs suggestive of COVID. So regular checkup is not advisable.
Right. For most patients in early stages who are undergoing therapy now, what is the usual regimen that they have to follow as far as either teleconsultation or visits to the hospital is concerned? How frequently do these happen?
So for the newer patients, teleconsultation is not advisable. Reason being, newer patients require a lot of time to be counseled and to be uh, told about how the treatment will go about. And what I feel on teleconsultation, these things are not, we are not able to do it properly. For the old follow-up patients who have been in regular touch with us, so for them to understand what we are saying and how to go about it, that is more possible. So for the first consultation, if a newly diagnosed patient is there and he requires treatment, once a teleconsultation can be done with one of the oncologists, but doing a doctor shopping through a teleconsultation would not be as advisable. For that matter, if you have decided to take a treatment with particular doctor, go and meet the doctor and see how the treatment has to go about, what is the prognosis, what is the stage, how much cost it will be for the patient and for the family. So for the first time, I would not advise teleconsultation. For the follow-up, for the old patient, teleconsultation is fine.
Right. So, what happens to those patients who have been newly diagnosed but urgently require surgery? Given the current situation these days, what is the timeline with which they can work towards, getting themselves admitted for surgeries, and how long is, on an average, the hospital stay?
So it depends on the urgency. If it is urgent, you have to weigh the risk and benefit. अगर कोरोना का खतरा कम है और सर्जरी ना कराने का खतरा ज़्यादा है, तो ऑब्वियसली सर्जरी करानी है. आप हॉस्पिटल जाइए, अपना कोविड का टेस्ट कराइए. अगर वो नेगेटिव है, तो आप आराम से सर्जरी करवाइए. अब सब हॉस्पिटल्स कोविड के प्रिकॉशंस लेके ही सर्जरीज कर रहे हैं. लेकिन अगर वो सर्जरी डिले हो सकती है, तो वो डिपेंड करता है कि कौन सा कैंसर है. ज़्यादातर कैंसर्स में आप 1-1.5 हफ्ता तक वेट कर सकते हैं, क्योंकि इसमें कोई मैच नहीं है कि हम बता दें कि आप 2 हफ्ते वेट कर सकते हैं, कि आप 4 हफ्ते वेट कर सकते हैं, कि 6 हफ्ते, बिकॉज हर एक कैंसर अलग अलग स्पीड से ग्रो करता है. सारे ब्रेस्ट कैंसर एक स्पीड से ग्रो नहीं करते, सारे गॉल ब्लैडर कैंसर एक स्पीड से ग्रो नहीं करते. आप वो किस्मत की बात है कि पेशेंट मई मार्च में डायग्नोज हुआ और जुलाई तक उसको कुछ नहीं हुआ, और कुछ ऐसे भी पेशेंट है जो मार्च में डायग्नोज हुआ और अप्रैल में उनकी डेथ हो गई. So we don't know कि कौन कितनी जल्दी प्रोग्रेस करेगा. So what we advise is to get the surgery done as soon as possible. If the COVID is negative, then you can get the surgery done easy. No, that's not a problem.
So, Dr. Mittal, say a surgery is required and the patient gets admitted, it's done. Then what is the recovery time and what are the precautions taken in the hospital itself so that the patient recovers but is not exposed to COVID?
So the precautions what we are taking is that after the patient has been tested for COVID and he is negative, we are admitting the patient, and the staff is also getting themselves tested every 14 to 15 days. The surgeons, the housekeeping staff, nurses, ward boys, pharmacists. So we are taking them also so that you don't catch COVID from us. So if everything is fine and we try and keep the hospital stay minimum for maybe 2 or 3 days, this hospital stay is required, and after that, after 10 days, you have to come back for the stitch removal or the follow up. So we try and keep the minimal follow ups, and we give appointments to patients so that there is no crowding in the OPD area. You come at
Mhm.
that time. Minimal patients are allowed from outside, from the main door towards the OPD. One patient is finished, then we call up the guard, and then he'll send in the second patient so that the patients are not exposed to each other also.
Right. And once the patient is discharged post surgery, what are the extra precautions one must take at home?
You should follow the diet what we have advised, the medicines what we have advised, and keep continuing the social distancing because you have undergone a surgery for the cancer. So you are at prone to catch COVID easier than compared to the normal population. So keep continuing the social distancing and keep taking the medicine. As such, there is no other preventive medicine for the COVID. So the guidelines are same for everybody.
Right. Now we are seeing, the countries opening up, and now even, entertainment centers, cinema halls, they're opening up. And, would you think that it is absolutely unsafe for cancer patients to visit these, even if they are they're not COVID positive? Can they go to these social areas taking, what precautions should they take?
I personally feel all these centers have been opened up because to prevent the economic breakdown of the country.
Hmm.
कोरोना खत्म नहीं हुआ है, कोरोना का डर खत्म हो गया है। लोगों के बीच गुस्सा ना आ जाए इसलिए गवर्नमेंट ने ये सारे सेंटर्स खोल दिए हैं, चाहे जिम हो, चाहे टेम्पल्स हो, चाहे रिलीजियस प्लेसेस हो। और ये इसलिए खोले हैं क्योंकि लोगों की आमदनी कम हो रही है, लोग परेशान हो रहे हैं, चोरी चकारी ना बढ़ जाए, लूट-पाट ना बढ़ जाए, इसकी वजह से ये सारी चीज़ें खोली हैं। लेकिन अभी भी मेरे को नहीं लगता बहुत सारे लोग इस चीज़ को फ़ॉलो कर रहे हैं कि वो मास्क पहने आप मार्केट में जाइए, लोग फ़ॉलो नहीं कर रहे, दे हैव बिकम रिलैक्स, दे कि जो होगा देखा जाएगा। लोग घूमने जा रहे हैं, मसूरी जा रहे हैं, शिमला जा रहे हैं, सब जगह जा रहे हैं। ठीक है, सब परेशान हैं, लेकिन इस स्थिति के अंदर कैंसर पेशेंट्स को डेफिनिटली शुड नॉट पुट देमसेल्व्स एट रिस्क बिकॉज़ अभी तक कोई वैक्सीन निकली नहीं है, कोई ट्रीटमेंट निकला नहीं है और मैं अभी भी पेशेंट्स को देख रहा हूँ जो कि सफ़र कर रहे हैं और एक दूसरे से फैल रहा है। 30% ऑफ माय पेशेंट्स हैव नो सिम्पटम्स, कोई खांसी बुखार कुछ भी नहीं है, उनका टेस्ट कराया तो वो कोविड पॉजिटिव आ गया। तो मेरे हिसाब से कैंसर के पेशेंट्स को अपना सावधानी बरतनी चाहिए और इन सब चीज़ों से दूर रहें तो बेहतर है।
अब आप क्या सजेस्ट करते हैं कैंसर पेशेंट्स के लिए, क्योंकि सारा टाइम तो हम घर पे रह नहीं सकते। और मतलब हमारे जो फैमिली मेंबर्स हैं वो तो अपने काम के लिए जाएंगे और वो एक्सपोज रहेंगे। तो अब यहाँ हाउ डू यू फाइंड अ बैलेंस दैट यू डू थिंग्स दैट कीप यू हेल्दी, which is not just staying in a closed room, plus you protect yourself from others who are compelled to go and may expose themselves to
So
COVID.
that's true. Offices are opening. Your husband or sons or daughter-in-laws are going out for work because obviously the offices are open and they have to go out for work. So that's what I'm saying. So avoid going to a place where it can be avoided. Cinema hall,
Mm.
malls, eating out in a restaurant are avoidable situations. They are not necessary. Yes, for getting a life back, getting away from the boredom, for some excitement back in the life, I think other methodology should be used, maybe TV or carom or indoor games you can take because this is a matter of another, I think, 6 months or 1 year, and you have to be careful about that because once you get the COVID, then it becomes difficult to manage. But you have to again risk the weigh the risk and benefits. If you are ready to risk of going out and catching your COVID, then you go out. But obviously, if it's an unavoidable situation, मेरे पास पेशेंट्स आते हैं कि सर हमें पंजाब जाना है कि हमारी सिस्टर की डेथ हो गई है, उनकी क्रिमेशन पे जाना है, मैं अकेला भाई हूँ, मुझे जाना ही है। अब वो मजबूरी है, उनको जाना ही है, देयर इज नोबडी एल्स इन द फैमिली, तो वो जाना है। लेकिन सिनेमा हॉल जाना आई डोंट थिंक कि वो इतना नेसेसरी है कि आपको जाना है सिनेमा हॉल या आपको मॉल में जाके खाना है कि रेस्टोरेंट में जाके खाना है। तो यू कैन डू ऑल दोस थिंग्स एट होम ऑल्सो। So what is avoidable, you avoid. What is not avoidable, then you have to do it.
Right. Dr. Mittal, you meeting so many of your cancer patients, new patients, on those who are taking ongoing treatment. Now, with COVID-19, we have seen a number of mental issues also coming up. Are cancer patients doubly affected because they're already battling a disease that takes its mental toll, and then there is this fear of how things could go worse should you contract a virus which is all over the place. Um, is anxiety level higher? How are they reacting to the situation now?
Definitely, anxiety level is very high, not just for the patient, for the caregivers as well, because few of my patients it has happened that they had cancer, they had stage 4 cancer, they were doing fine, and then suddenly they got infected by COVID and they had to be admitted in isolation, and unfortunately they did not make it. So then the relatives could not meet for the last time. They could not talk because they were not allowed in the COVID ward. So definitely all these things go out and people hear such things. तो उनको डिप्रेशन होता है, एंजाइटी होती है. तो इसमें फैमिली को भी एक सपोर्ट की जरूरत होती है फ्रॉम द ट्रीटिंग फिजिशियन एज वेल एज फ्रॉम द काउंसलर्स एंड द साइकोलॉजिस्ट दैट they try and look at the brighter side and the positive side. So what I say them is to count their blessings. Obviously, this is unfortunate. This is unavoidable that you had cancer or you had uh, COVID and dual disease you are having. But look, you try and look at the brighter side that maybe you are financially well, your kids are well settled. So, so whatever the brighter side on that particular moment is there, try and look at that, and definitely the anxiety and depression levels have gone up, and that too also because many of the people have lost jobs. They
Hmm.
don't have money. They don't, somehow they were managing for the cancer and then they have to manage for the COVID, and बच्चों की स्कूल की फीस भी भरनी है और राशन पानी का खर्चा भी है, एवरीथिंग, एंड ऑन टॉप ऑफ दैट जॉब भी चली गई है. So all these things bring out the frustrations and anxiety and depression, and people do say that सर हमें कुछ ऐसा कर दो, हम मतलब खत्म हो जाएं या काम खत्म हो जाए हमारा, हम वी डोंट वांट टू लिव एनी मोर, हम बर्डन हो गए हैं. So we have to counsel them and give them, we have to tell them real life facts also, that many of patients have do come out, and we give them their phone numbers that you talk to them, because मैं शायद उनकी दुविधा उतनी अच्छी तरह समझ ना पाऊँ क्योंकि मैं उस सिचुएशन में नहीं हूँ. लेकिन जो पेशेंट उस सिचुएशन से गुजरा है, जो रिलेटिव उस सिचुएशन से गुजरे हैं और जो सक्सेसफुली बाहर आए हैं, शायद वो और अच्छी तरह से उनको समझा पाते हैं. तो एक ग्रुप काउंसलिंग या ग्रुप सेशन थेरेपी हो जाता है जिससे दे फील बेटर.
Support groups
सपोर्ट.
definitely are helpful in such a situation.
Yeah.
Now, doctor, for cancer patients who are midway through their treatment, you have done few things and it has worked, and now some things need to be tweaked. Maybe it has to be a mix of radiation and chemotherapy or some different protocol that you may want to have to take, given the presentation of the patient. How do you design a program given the evolving situation? What are the tests that have to be done, and what are the precautions for the patients who have to get these tests done?
What we are following and many of the hospitals is that if the patient is symptomatic, we get the test done. Otherwise, every 14 to 15 days, a regular checkup is done. If you are COVID positive, then the treatment is withheld. And when the patients become better, then we again restart the therapy. But otherwise, the treatment guidelines are still the same. We are following the same treatment guidelines. We are trying to give the same intensity of the treatment which we were giving pre-COVID. But yes, we try and monitor the patients on regular basis and screen them on regular basis to find out if they have any signs and symptoms of COVID. But the treatment
Right.
modality remains the same.
But if the treatment modality has to be changed, what are the steps or protocols to be followed?
So suppose a patient of lung cancer, he has progressed and he has a brain metastasis, he needs radiation. So
Hmm.
we do the COVID test and we refer them to the radiology radiotherapy department and they do radiotherapy. If the patient has bony mets, again he requires a change of therapy and radiotherapy is required, then we refer them to radiation oncologist, and they follow the same guidelines as it was pre-COVID, but with the caveat that a COVID test has to be repeated every 2 weekly, so that we are aware that we are not exposing any other patients or the caregivers, and also the machine, that it is exposed to the COVID. Otherwise, the treatment remains the same.
Right. So, on an average, if the patient is coming to your hospital for radiation, um, uh, what is the process there? How long does he have to stay? And then, how often does radiation happen on an average for patients who have been referred for radiation?
So we have two kind of radiation, in which one is for the 10 days of radiation is there, and other is majority is 6 weeks of radiation. And for that, patient needs to come from Monday to Friday every day. The actual radiation is about 10 minutes. So we give them appointment and we request them to adhere to their appointment. And if they are coming late, so they inform us prior, so that some other patient can be adjusted in place of them. And that's how we are trying to avoid the crowding at the radiation oncology department. Patients come, the physicist and the technicians are all ready. We feed in the data. The patient goes, lies down in the radiotherapy machine. He receives the radiation and he comes out. So by patients adhering to the appointment, it becomes easier to uh, do the radiation on time and avoid the crowding.
All right. So it is a streamlined thing, so long as you keep to the appointment timings and it doesn't take very long.
The actual radiation just takes about 10 minutes. If somehow some patient has been delayed or some problem has been there, then obviously you have to wait for a little longer time, and we try and keep a social in the waiting area. Also, we have put notices on the chairs that one chair is vacant, adjacent to the other chair, and one attendant is only allowed with the patient. Yes.
Dr. Mittal, what about chemotherapy? As much as I remember, chemotherapy, takes about 4 or 5 hours at the center. You may not be admitted, but it's like an intravenous drip. It takes time.
Yes.
So, is it possible that this can be done in a home setting at all? Or again, you have to go to the hospital, and what are the precautions taken there, and how much time again would it take?
So it depends on what kind of chemotherapy are you there. So some chemotherapies are just 30 seconds intravenous push are there. Some chemotherapies are 4 to 5 hours. Some are for 4 to 5 days. So for the push injection, we tell them to come on time in the daycare and we release them as soon as possible. For the longer schedules for the 5 to 6 hours, obviously we have reduced the number of beds in our daycare. We have increased the distance between the two beds, and we call them with appointment that this is your time slot, this is time you have to come. And we have requested the pharmacist and the billing persons also to, as soon as the nurse indents the medicine, please get the medicines quickly to the daycare so that the time is not wasted. And as soon as the chemo is finished, the billing is done quickly so that the patients are able to go home. For the insurance patients, also for the TPA patients, we request them to send someone to get the TPA approvals, because it takes about 4 to 5 hours to get an approval once the chemotherapy finishes. So if they have the pre-approval, then they can be discharged quickly and they need not stay in the hospital even after the finish of the chemo, because the bill still has to be paid by the TPA. So all these measures we are taking. For the chemotherapies which are for 4 to 5 days, patient definitely needs to be admitted in the hospital. As far as it concerns for the chemotherapy at home, it was initially thought by our forum that few chemotherapies can be done at home, but there were medico legal issues, so it was not propagated.
Feasible?
It was not feasible to get the chemotherapies at home. Although few of the companies are saying that they will do the chemotherapies at home, but they need the prescription of a medical oncologist. But if something happens to the patient at home, the onus lies on the medical oncologist. So if he's not there physically, it becomes difficult to take the onus that something happens to the patient at home. He's suppose the patient is at Hisar or somewhere, and I have given the prescription, and somebody gives the chemotherapy, and something happens to him. So the medical legal issues are also there. So we are not promoting chemotherapies at home, except if the chemotherapy from injection can be converted to the tablets, then it's fine.
Right. Can there be, any way by which, hospitals tie up with district medical centers or something like that, so that, chemotherapy can be given under the care of medical personnel if the person is unable to travel to the main hospital?
Yeah, that should be there, but that cannot happen at individual medical oncology personal level. It has to
Hmm.
happen between the state government and different state governments, and it has to happen between the understanding between the hospital fraternity and the district hospital. So all these things will take time, and I don't think they keep it as a priority in current scenario because many other things are there for them rather than tying up with the hospital. But definitely one should try for that. The government should try to do that tie up.
Right. Uh, just wanted your thoughts on this. How can cancer patients prepare themselves for normalcy after the pandemic gets over? You yourself said you think it's going to be a matter of another 6 months of this kind of condition continuing. Post 6 months, then what would their lives look like?
It depends on what kind of vaccine we are looking for. If it's a
Hmm.
live vaccine, then obviously we can't give those vaccines to the cancer patients because anything live needs a good immunity in the body so
Hmm.
that the body can produce a immune
Antibodies.
yes antibodies against it.
Hmm.
But if it's a dead attenuated vaccine, then it's a boon for everybody, even for the cancer patients, dialysis patients, or immunosuppressed patients. They can get these vaccines. So the answer lies that what kind of vaccine comes up, and is it because now I don't think the trials are being done specifically for cancer patients because the trials
Hmm.
would have been whatever are going on is being done for the normal
For
person,
general
for
population.
जनरल पब्लिक who doesn't have any comorbidities, कोई
Hmm.
तकलीफ नहीं है उनको. तो वो उसके सक्सेस होने के बाद वो डायबिटिक या हाइपरटेंसिव या डायलिसिस या कैंसर पेशेंट्स के लिए वैक्सीन का ट्रायल करेंगे और उसमें कितना टाइम लगेगा, nobody can really say that.
तो आपको लगता है कि ऐसी सिचुएशन कुछ देर के लिए चल सकती है और कैंसर पेशेंट्स को ज़्यादा सतर्क रहना पड़ेगा और अपने अपने ट्रीटमेंट को वो फिर कैसे अप्रोच करें?
सिर्फ कैंसर पेशेंट्स को नहीं, सब पेशेंट्स जो जो कोमॉर्बिड हैं, किसी को सीओपीडी है, एस्थमा है, डायलिसिस
हम्म,
है, रीनल फेलियर्स हैं, ब्रेन की डिसऑर्डर्स हैं, उन सबको केयरफुल और सतर्क हमेशा ही रहना पड़ेगा कि भाई बॉडी में एक बीमारी तो ऑलरेडी है जिसकी वजह से मल्टी ऑर्गन डिसफंक्शन है, उसके ऊपर एक बीमारी और आ जाए तो डेफिनेटली वन हैज टू बी केयरफुल एंड ट्राई एंड टेक प्रिकॉशन फ्रॉम देयर साइड. बाकी जो किस्मत में वो तो है ही देखो, लेकिन जो आप अपनी तरफ से कर सकते हो मैक्सिमम कि भाई हम सब प्रिकॉशन लें, बाहर घूमने ना जाएं, अननेसेसरी बाहर ना जाएं, मास्क पहने और वो सब जो फॉलो अप कर सकते हैं वो कर सकते हैं. उसके बावजूद भी किसी को हो गया तो वो nobody can help in that. That's unfortunate, but at least you know that it was not your fault. You can leave it that on
just bad
testing.
luck.
Yeah, bad luck, you can leave that on testing.
Right. Uh, in your practice of all the patients that you have seen,
Mhm.
uh, could you tell us if many have deteriorated during this COVID time for no fault of theirs because of a disruption or a delay in the treatment? Has this been a real problem?
Yes, because when the lockdown started in March and then it opened in August, about 5% of the patients had progressed. They had progressed, and even now patients are scared to come because cases was again started to rise in Delhi. So patients
Hmm.
were afraid. So now they come in September or October, the disease has spread, and obviously they also feel sorry, and nothing can be done because they didn't have any modes of transportation or they didn't want to come. They were stable and they were fine. So my about 5% of the patients have progressed, but we are trying to control the disease by again giving them therapies and motivating them to uh, take the therapies on regular basis.
All right. Thank you so much, Dr. Mittal, for joining us today and discussing with us cancer care during the COVID period. So, Dr. Mittal's advice is to keep yourself safe, avoid the unnecessary, outings or risk taking, because as a cancer patient, you need maximum precautions. But that shouldn't mean that you should not keep a regular routine in your treatment. Do not be scared to visit your doctor or take the treatment that is required, because like Dr. Mittal has mentioned, this shouldn't lead to a progression of a disease for reasons of being fearful of not taking the follow-up that is required. Thank you so much, Dr. Mittal, for joining us today and giving us your opinion on how cancer patients can best face the situation when COVID is still raging across our country. Dr. Mittal feels, the situation may stay for some time, and cancer patients should be cautionary, but they should continue with their treatments. Thank you so much, Dr. Mittal, for joining
Thank you.
us.
Thank you.